folks, let me get right into this. I mean, listen up. My brother introduced me to Dr. Kenrick McCarty. And let me tell you, our conversation was epic. We started talking hormones. Before you know it, we're talking business. And I got to say, this guy really knows his stuff. He's the real deal. Dr. Kendricks, he's also been using BizOps, and it's made a huge difference in the way that he operates his business. But we're not here to talk about that. Okay, we're here to answer the questions that you really want to know. And that's, is it safe to get started on TRT or HRT? So Dr. Kendrick, tell us a little bit about TRT. A lot of people have got these like this idea in their head that TRT means steroids. And, you know, it's like this back room, back of the gym, you know, private thing where people are passing little vials out to each other with needles. I mean, that's not it. That's not what it is today. So, you know, a little bit on the stigma, but really tell us, you know, is it safe for people to take TRT, and why should they do it?
100%. You know, testosterone replacement therapy is exactly what it says. It's replacing a bioidentical hormone that is natural to our bodies. Unfortunately, in men and in women, it depletes with time. And if you don't recognize that, you're just fighting against yourself. I mean, your body's not running at its optimal levels. Your energy's going to tank. Your sex drive's going to tank. Your metabolism's going to tank. And instead of accepting these things as a normal aging process, you know, it's better to kind of get ahead of it, be a little more proactive, and, you know, seek out treatment. The bad thing is when you think about testosterone, it does have a bad stigma. Testosterone being labeled a steroid is false. Steroid is just a made up term. You know, it's a made up term for illegally obtained hormones. Whether it be testosterone or some sort of testosterone derivative, all of them were at one point in time a medication that was approved for a medical treatment. Once they become abused and obtained illegally, then you get the stigmatic steroid. But testosterone in general, again, it's a natural hormone that is again a bioidentical hormone that is just something that depletes with time. And if you don't recognize that, only thing you're doing is just you're treading water, and you're going down pretty quick.
So the thing that I find really interesting, you know, your point is like spot on. I mean, a lot of the listeners on here come from that fitness side. They're in the gym industry, and I didn't realize how valuable TRT can be, how valuable having that replacement can be. You know, I come from the fitness background. I've got a master's degree in exercise physiology. You don't talk about a lot of this stuff in school. And the fact that TRT can improve bone density, which we kind of would expect, but reducing the risk of cardiovascular disease is the big one. And I think that's been heavily studied recently. So, you know, tell us a little bit about like where that research is going, like how people are understanding the use of TRT and its reduction in cardiovascular disease, or the likelihood of it happening.
Well, the big picture here is not just cardiovascular disease. And if you look around, if you go to a local Walmart, if you go to a restaurant, you find very easily what the problem nowadays is. It's obesity. Cardiovascular disease is related directly to obesity, and we are at all-time highs when it comes to obesity. So when it comes to testosterone replacement therapy, it's not only an indirect, but it's a direct relationship in improving overall health, including cardiovascular disease. But again, it comes down to the major point of, if I'm tired, if I have no motivation, I don't want to get out and improve my quality of life. I have no desire to do that. So when you fix the underlying problem, which is usually going to be related to an insufficiency in some sort of hormone, whether it be in men, testosterone, in women, they have a multitude of hormones. And that's the difference you had reflected on earlier, was the difference between TRT and HRT. They're, women, again, have testosterone, but they have estrogen and progesterone as well. But again, when you have an insufficiency in hormones that are responsible for these underlying drives as a person, as a man, as a woman, you get an overall sense of improvement in energy levels. They have a desire to get back out there and start exercising and improving their quality of life, which in turn minimizes the risk factors for cardiovascular disease by changing the lipodensities and cholesterol, improving blood pressure by losing weight, minimizing the risk factors for obtaining or acquire type 2 diabetes, which is usually a subset of obesity. So again, it's a holistic approach. It's not just cardiovascular disease. It is getting people up, getting them moving, getting them back to an exercise regimen, and basically, again, trying to combat the things that are secondary to, poor nutrition, lack of movement, and acquired diabetes with obesity and cardiovascular disease. It's a holistic approach. And again, I think it still comes down to the bottom line of to be able to identify that there is a hormonal problem and not just look at trying to normalize it, but optimize it.
So would you say, as soon as you start talking about like the underlying issue, yeah, like I said, I'm on the fitness side. So most of my time, what does everybody want to do? They want to get fit and get in shape. That's one of their New Year's resolutions. And that thing tails off real quick. People don't want to do it anymore after about a few weeks. But a big chunk of that is the motivation factor. They don't have the energy to get out of bed or get off the couch and stop eating those chips. Do you think that you could take somebody, obviously, you as the practitioner, you have to go through and, check all their levels and everything, make sure everything's good on the charts. But is there a bigger advantage or a benefit, I should say, to someone who's obese, overweight, they're out of shape, and they're kind of going toward that bad direction of, having a lot of problems. But if their health is saying that their, the blood's lipids, the measurements that you're taking, they're saying that they're okay internally for the most part, would you be able to get them on TRT, and then theoretically that would, or scientifically, that would take their level of motivation up a notch where they're going, you know what, I can actually stick with this game plan that I have for this year and follow through on it and have the energy to wake up early in the morning or stay up a little later at night, not have that fatigue that I'm having because I'm overweight. Are you like fixing that little bit of a problem so that way that one component of them saying, man, I want to get after it, I want to go work out, I want to eat healthier, is it also helping change the mindset a little bit so they do those things?
It is 100%, because you touched on quite a few things and my mind's just racing. It's a underlying identification of an insufficiency. So again, if you don't identify that, you as a person, not you in particular, but you as a person that's trying to tell themselves to feel better, let me get in the gym, let me eat better, there's going to be some roadblocks. There's going to be a lack of motivation, a lack of energy, and a lack of results due to a dysmetabolic problem. And that's the problem is people that finally recognize or they jump off the couch and it's January 2nd and they want to feel better, it pewters out pretty quick because, again, they don't get the results that they're desiring because there's something underlying that has not been fixed. So it's not only the point of getting to the gym, it's making sure that the body is not fighting against some sort of pathophysiologic reason why it can't lose weight. There's two main things that people come and reach out to me about. I have no energy, I can't lose weight. And they usually go hand in hand. You can't treat weight gain without ruling out some sort of other biologic reason why you can't lose weight. You can put yourself in a caloric deficit, but again, if you're dysmetabolic on an internal standpoint, you're only going to be able to lose so much before you hit a plateau, and that's when people get frustrated, they get discouraged, and again, like you said, they pewter out pretty quick because they don't have the results that they desire, that they're putting in the work to try to achieve, and their lack of drive, their lack of energy just kind of reverts them back to December. If we talk about the resolution, it reserves them back to December, where they just don't have that internal drive to motivate themselves to be better. It's tricky because women in particular, they have a understanding that when they go and see their gynecologist every year, that they rely on them to do the necessary blood work to make sure that they are checking their hormones and trying to find out where they are in their life cycle of perimenopausal, premenopausal, postmenopausal. And again, I feel like there's a lot of overlooking or a lack of diving deeper into these hormone blood panels for women, that they just they get pushed to the back of the burner, and they feel like they're just kind of getting older and they're waiting for menopause, and that's when things start changing. But I tell all my women, between 25 when you're optimal and 50 when you're postmenopausal, there's always something changing. There's something that can be done to utilize supplemental therapy and to try to optimize before you hit those crucial parts where you are really climbing yourself out of a trough versus just being a little bit more proactive.
So I got some questions. You talk about your mind racing. I'm sitting here like I'm going with all these ideas and questions, but it's curious to me. Like, I'm curious about this. Like, if the physician that came in, like, I'm overweight, I'm going to see the doc and I'm saying, hey, I don't feel so good. I feel out of shape and I want to do something about it. And they go through the options. And I'm wondering if ever during that consultation with the physician says, hey, let's get some blood work. Let's sit down and just see if your hormones are where they need to be. And maybe you're going to be a happier person and have more motivation to go exercise and eat healthier. Or do they sit down and they go, let's check the boxes. Are you suitable for liposuction? Are you suitable for band, treatment or sewing up your stomach or taking a part of your guts out? What's the thinking behind that? And part of me is going, well, no wonder why there's so many treatment centers that offer HRT and TRT that have popped up over the past 10 or 15 years, because maybe this crap's not happening at the doctor's offices where they're giving them better recommendations on how to be healthier. Because I've always wondered to myself, why are our doctors, why are they not referring patients to health clubs first? Why are they not referring patients to nutritionists first? Maybe they're doing that, but they're doing it internally at the hospital. But I don't feel like that's happening, at least on a big level. Maybe it's happening on a small level, but not on a big level to make big changes.
I'll give you two things. One, most of the providers, and I'm going to just kind of use a vague term of most providers on a primary care basis, they don't treat until you have a diagnosis. And in order to create a diagnosis, you have to be abnormal. And that's a big problem when it comes to hormones. You can't classify hormone insufficiency based on abnormal and normal, because you never know where the baseline of that patient is. Okay. So you got to understand that when you talk about reference ranges, for someone that's not savvy in hormone replacement therapy, they only look at ranges. They're given this range. Your primary care says, hey, man, I understand that you can't lose weight. You're tired. Your intimacy issues are kind of, becoming a more progressive problem at home. But, man, I ran your testosterone level and it's 350. It's normal. But you're talking about a range between 300 and 1,000. Okay, so the problem lies in the fact that you have men and women being classified as normal and abnormal versus optimal and not optimal. And that's my approach, is a lot different in the sense that I don't care that you have to be normal or abnormal, because you can't categorize people with that large of a reference range and basically overlook that their complaints are not suitable for treatment because they aren't considered abnormal. That's a problem on the primary stretch. And that's what I think is answering your question for the most part. The gatekeeper, which is the primary care providers, don't grasp the concept of optimal versus not optimal. They are very restricted in their thinking that it has to be abnormal to treat it. And that's poor. If you step back and you see how treatments are changing to be more proactive, okay, you would rather be preventative than treat a problem after you've already obtained it. That's where the problem lies with obesity and type 2 diabetes. That is an acquired disease process that tends to happen after you've been diagnosed. You're not proactive enough to get these people to change their lifestyle modifications and look for an underlying problem before it becomes a proper diagnosis to consider treatment. So I think I kind of touched on that a little bit. I think the forefront is not doing a great job at screening these people and having proper recommendations because they don't feel like they are classified as abnormal to receive hormone replacement therapy. And then to touch on that again, they don't refer out to places like myself because a lot of insurance companies do not pay for services that I offer. And, you know, some of the patients don't have the financial means. But again, there's a big difference between what I do and what some of these other health company, clubs, organizations do. I am very, very structured to make it affordable because I don't think that there should be any limitation to people and accessibility to this service. Even though I know testosterone is usually not covered by most insurances. So I have formulated it to try to make it as available to the masses as possible. So I think between those two things, one, it not being recognizable as a covered insurance service, and then two, the forefront is just not doing an ideal job at getting the people to us or at least trying to initiate therapy until it leads to until you have a disease process that they can treat.
So there's some research that goes back and forth on TRT. You know, some of it says that if you were to use TRT, you're improving your health and your longevity and quality of life and everything under the sun. And if you don't use it, you're not. But then there's also research that is suggesting that if you do use it, you're increasing risk factors versus not using it. So, you know, it's kind of this unbalanced scale. There's probably more research that shows the benefits. But at the same token, I look at that and I go, all right, well, I'm a guy, I'm in my 30s, you know, I'm in my 40s now, but in my 30s, I'm going, you know, I'm noticing differences in the way that my body works or the way that I function. And I attribute it to, well, I'm just getting older. That's expected. So is the cycle supposed to be you just get older and your testosterone levels drop, your hormone levels drop across the board for everyone and they just deal with it and that's life? Or is it, no, there is an optimal range and you should be maintaining that for how long? You know, up into your 50s and 60s, 70s, 80s. How long do you maintain that? I know plenty of people who've been on TRT for, you know, several years. They say they've been on it for 20, 30 years and they couldn't say anything better about the changes they've made in their lifestyle. But what's the point when you start making those decisions? Is it something that you go, all right, you know, like you're really hugging those trees and you're going, I'm getting older, I'm going to stay getting older. And that's just the life. That's the cycle of life here. Or is it, no, I'm supposed to have this, you know, set range forever? Or, and what is that forever? You know, is it a limited period of time? You know, when do you let it drop?
So again, it comes down to accepting versus being more proactive. And if you look at today's society where anti-aging is becoming more and more mainstream, you know, whether it be these aesthetic creams and injections and peptides and living longer, healthier lives, because again, the medical community is always revolving to try to improve quality of life. That is what we do. We're trying to stay on the cutting edge. And of course, you know, 50 years ago, there was a lot unknown when it comes to anti-aging. So it's taking advantage of today's situation and the technology and the knowledge that has been gained through hormone replacement therapy, anti-aging properties, and saying, no, it's not acceptable to be 45, get home and sit on the couch. You know, it's really not. Now, I have guys that come in all the time to say, well, what's normal for my age? And it's like, what does it matter what your age has anything to do with? Nothing. You know, do you want to feel like you're 50 or do you want to be 50 and feel like you're 20? That's the thinking that I'm trying to portray to people. There's no reason why you should accept age as the limiting factor. All right. So we know that our body as a whole is a machine. Okay. We're breaking down every day. We're breaking down on an annual basis. Men lose testosterone approximately 1% to 2% every year. So
now what point does that happen?
Starting after 25.
Okay.
That is old research, and I'm going to circle back to that because, again, there's some new data that even shows that even young men nowadays compared to 20 years ago, significantly different. And that's true. I mean, you look at today and you can always say you see the older generation, you just say they're just not built the same. The older generation, they were studs, I mean, you didn't have these young guys that are pewtering out, and I feel like there's some other components that are leading to younger men and lower testosterone. And I think that's something we should probably touch on as well. But circling back around to what you were saying, it's recognizing the fact that we are breaking down as a machine. You can be proactive. You can take those levels and accept the fact that you are going to continue to lose testosterone every year for the rest of your life. Or you can say, well, why not supplement a natural hormone that I'm supposed to have this much, and now I'm this much, and why should I accept that versus being back up here 50 years old and feeling like a champ again, and that's where this push is going towards. It's finding that optimal zone for men that are recognizing the symptoms of low testosterone, regardless of how old you are. Regardless of how old you are, you want to feel like you're 20 again. And that's my thing. I tell guys, I can't make you 20, but I can make you feel 20. And that's what they want, and then when you can replace that sense of that motivation, that get that mojo back, now you're talking about increasing activity levels, wanting to feel better, wanting to look better, and wanting to live longer life. And that in turn is going to improve internal mechanisms like cardiovascular disease. That's the one thing you talked about earlier, is because the more active you are, the stronger your heart is, the less your cholesterol is going to build up these low density lipoproteins, which is associated with sclerotic changes in the vessels and lead to heart disease. These are things they snowball. So the more metabolically inclined you are, the more active you are, it's going to improve your quality of life from many perspectives, not only just in general from being more lively, but again from a risk factor perspective.
I have a couple more questions on men. Then I want to jump into women because I think that's a big spot that's getting missed.
Yes.
My wife even talks about where she's at, and she's in her 40s. So I look at this and I go, for men, one of the big questions that they get, and I'll just say it like it is because that's the reality. They're concerned about their testicles shrinking. They take this stuff and, hey, my testicles shrink, or then I have acne, or that I have mood swings and I'm, like this animal and angry. And then you flip that on its head, and now you got this, hormonally charged, testosterone enraged 20-something-year-old, 50-year-old guy that's coming home to his wife, and she has zero interest in any kind of activity, right? So let's talk about the men. Then I want to switch over to the women because that's not even, that a lot of times is not even talked about. So let's talk about these guys that are having those concerns. So I threw a lot at you.
I like that you kind of set the platform up for treating only half the problem. And I've experienced that, and I think that's a good touch on where you're talking about only treating the men and having the women at home like, hey, get off me. But so the men, the risk factors, of course, the one that everyone talks about, including testicular shrinkage, is prostate cancer. And that is one that I just want to kind of throw out there because that's always a concern. Testosterone does not cause prostate cancer, period. 100%. It does not cause prostate cancer. If you are predisposed to having prostate cancer, whether you have a strong family history of it, whether it's surrounding your brothers and dad had it, now you have to take that in consideration. And the way that we do that is just through blood work. I mean, and if you do the appropriate workup, which is there's a serum level called a PSA, a prostate specific antigen, that is very easily obtained. You don't have to go to the old school digital rectal exam to have this thing ruled out. It's done in the blood. So very easy to keep an eye on. You get a foundation PSA level and you monitor that throughout your TRT replacement. So to circle back around, it does not cause prostate cancer, but if you do your due diligence and make sure that there is no predisposition to prostate cancer, you are just as safe as anybody else is. Now, if you start testosterone replacement therapy and you have an undiagnosed prostate cancer, it is like throwing fuel on the fire. Because this element breaks down into an active form of testosterone that attaches to the prostate, and it will definitely speed up replication of those cancerous cells. So if you do the proper workup, which you should anyway, you don't miss that.
Okay. All right. So that takes care of, I think, a few of the concerns that the men are going to have. But
testicular shrinkage.
Get into that.
All right. So let's get into that. Your testicles have a purpose in life. All right. They're not there just to be cool. They're there to, produce, certain bodily fluids that help us procreate. Okay. Essentially, that's what they're there for. When I talk to the majority of my men, I would say 85% of them have already completed their family planning. They are no longer interested in maintaining fertility. So I tell them, hey, man, your testicles they've done their job. They're not really suitable to continue to be as bulky as what you feel like they need to be. So when you start testosterone replacement therapy, an exogenous hormone like testosterone suppresses the stimulating hormones that are responsible for telling your testicles to continue to produce testosterone and sperm. So when you suppress that, you will have testicular shrinkage. It's part of the game. There are some medications that you can try to help alleviate that factor. For my guys that are super self-conscious and want their bulky testicles, I say, hey man, there's some things that we can get on board to try to help that. But again, in the grand scheme of things, it's an aesthetic thing. How many people are going to see that? You and your significant other. If it's nothing to do with fertility, it's not a problem, other than the fact that you recognize that there is going to be some shrinkage because we've essentially overtaken that job and suppressed what their normal function is to do. So again, it's going to atrophy just like anything else that doesn't get used. If you don't walk for a month, your legs are going to shrink. But it just happens. It's just shrinkage because of its atrophy. It's no longer being utilized.
So let's jump into women. That's, I think, anybody who has a question about those things for men who are listening to this, they're going, man, that's super helpful for me. Now let's talk about the ladies. Right. You got one problem where their man is on TRT and they're coming in hot at the house. And then you got the women who, they're just going about their daily lives. Some of them are already in the process of menopause, or they've already had menopause. Some of them have had, surgery to have things removed. Yeah. And, what's the likelihood of them even getting on some kind of hormone replacement therapy, or why even do it at that point?
And, the men are usually the factor that communicates with the other, their significant other, their spouse, whoever that should be, to recognize the fact that, hey, look at how much better I feel on hormone replacement therapy. When I started, it was based around men's health. Because there is a lack of that. Women see their OB-GYNs every year. They can communicate with them pretty readily. They have routine blood work. Most healthy younger guys don't have a primary care provider. They don't go and see anybody because they feel like they're invincible. They're not having any problems. So when I treat the guy and I get them feeling, like they should again, their energy's cranking, they're feeling themselves again, their sex drive is up. They're coming home, they're ravishing, they're trying to, grab the old lady, and they're trying to get back to old school times, which is great. But when it's not reciprocated, it becomes a problem. Okay. And I have seen that firsthand, that I was causing actually more friction at home, because then you have this discrepancy in, the guy that feels like a stud now, and his wife is feeling like a dud, and unfortunately that's a problem. And I don't mean to put it in those terms, but
it's reality. I mean, that's what happens. So
it's reality. And the problem is I was causing some problems at home because the guys had recognized how bad they felt. They reached out. I got them feeling better, and then now they're going home and they're not getting that connection reciprocated. So I started recognizing that, and that's when I started incorporating women's health as well, because a lot of my men were now saying, please see my wife. Their OBGYNs are not doing blood work. She's 35. She's not in menopause. We're not having kids anymore, but she doesn't feel like herself, and they're just telling her that she's fine. So that's where I started the women's health incorporating into my clinic because of that very reason. And since then, it's been fantastic. I have tons of couples coming together. I see, I even did some couple specials, it's, where a consultation is not only just for one person. You can come in and do a couples consultation at a discounted rate. And I think it's been phenomenal. I've got a lot of great feedback. And really, that's what helps me kind of move in the direction that I do, is because all the good feedback I find, from men and women. It's like, hey, I felt like we lost this connection, and now we're back on, cloud nine again.
So I'm going to stop you because I know that this is an issue. Can women with menopause, can they get on HRT?
100%. So the major misconception is that HRT causes cancer in women. Okay. And
yes. Yeah. Big study in the early 2000s about that.
Big study. Now, I would say that there is a huge cancer concern when it comes to estrogen replacement. And that is the one that is responsible for the majority of female-driven cancers. Breast cancer, ovarian cancer, cervical cancer, uterine cancer, stuff like that is very much attached to estrogen. So if there is a strong family history of any of those cancers, estrogen replacement is usually contraindicated. Okay, but when it comes to the other two, there's three major sex hormones for women: estrogen, progesterone, and testosterone. So I have had plenty of women that have been contraindicated for replacement of estrogen, but I put them on progesterone, which is a cancer protecting hormone, and testosterone, and have phenomenal results. And I don't know if we want to touch on that.
Yeah, I think it's a concern, because I'll talk to my wife, and if I were to say, women have testosterone too, of course she knows that because she has a science background, but it's the idea that extra testosterone is going to make her big and bulky, change her voice. She's popping on stage and she's got bigger arms than I do. So,
it's funny that you say that, because a majority of the patients that I see, women, older women, they don't even, because your wife has a background in science, she's aware that there is a testosterone derivative that they have naturally. A lot of women don't realize that they have testosterone, so they automatically assume testosterone as a man hormone. So when I talk about that steroids, that comes back around. But women have testosterone in their range. They have a range anywhere between 10 and 50, which again goes back to those ranges. I don't really like to use ranges, but just something to reference. Women have that, and when I talk about replacement of testosterone for women, the concentrations that I use are very, very, very small. But again, testosterone does the same thing for women that it does for men. Improves their energy level. It increases their sexual drive. The sexual complaints that they have downstairs with painful intercourse, dryness, those things can definitely be related to a lack or a deficiency of testosterone. Metabolism, when women say, look, I've been very active my entire life, but now I'm 45 and I can't lose weight. It is usually a dysmetabolic problem related to their anabolic hormone, testosterone.
Interesting.
So, again, when I replace testosterone, I'm doing the same thing for women that I do for men, except the fact that I'm keeping it at lower concentrations, and I'm not ramping them way up. I'm not having them grow a beard. I'm not having them change their voice. So the concerns that women have are the same things that you would expect. am I going to grow hair? Am I going to have voice changing? Am I going to have any physical changes, to my ladyhood downstairs? So, and I always have to reassure them, like, I got to give the disclaimer. It is testosterone. Those things are possible at way high doses. The doses that we talk about do not cause any of those. The most that I typically have is a little stray hair here and there that I see a woman and say, oh, hey, that was there anyway. I pluck it and it's gone. But maybe a little bit of skin changes. But again, it's kind of like going through your adolescent puberty stages again. Your body's trying to recalibrate those hormones while I'm trying to figure out what doses work best for you. There are some associated skin changes and things like that. But for the most part, women and testosterone, it's like peanut butter and jelly. I mean, they're supposed to be together, and it makes them feel much better. So again, to try to reassure them that testosterone causes all those things, it doesn't.
Okay, so now let's touch on the fact that it and I think it goes on both sides too. It's not just women, but if I'm getting on this TRT or HRT, am I going to be injecting? Am I having a needle in me every day? What's the frequency of this, and what does that look like? I mean, is it something they can do subcutaneously where they get something in their skin, or are they taking pills or they rubbing lotions on them? What's going on with that?
There's different modalities of hormone replacement therapy. And, when it comes down to options, there are creams, there's oils, there's, injections, there's pellets, there's pills. There's some that I prefer just because they're more a natural approach to how hormones are responding in our body. I don't tend to have protocols. That's one thing about me. I'm not a protocol driven guy. I tailor fit everything. So when I talk to a woman, I'm going to say, well, hey, what do you feel like would accommodate your situation best? And then I try to tailor fit that treatment program for them. So for women, even if we go the route that I prefer, which is injections, okay, and once a week, very, very easy to accommodate, I prescribe testosterone subcutaneously injectables for women. Subcutaneous is less masculine, I feel like. Women have a little bit more subcutaneous tissue than men. And again, I think it's a little more dainty. I think women don't like the idea of needles. And when I tell them, hey, it's similar to a little insulin needle, they're very responsive. Okay. So I haven't had any woman that has complained about the injections. Most of the time they say, man, they come back and say, I didn't even feel it. So the injections are pretty easy to accommodate. Their once a week injections is the most the most effective means that I like to utilize in my practice because, again, the medication that I use has a long half-life. So it's not something they have to do on a daily regimen. Some women that don't like injections would prefer creams. That's a daily thing. That's a messy thing. That's an absorption thing. There's a lot of variables that play a role in that. I'm not that big of a fan of it. I only have a very minimal amount of people on that. So, if you can't tell, I'm in about injections. I think that's the most effective way to replace hormones. I can change dosages like that. Again, I think it's very easy for the women to accommodate, and I've had great success and a lot of positive feedback when it comes to women and testosterone replacement.
Okay. So, I think anybody listening to this, if you guys haven't, and gals, if you haven't heard or you felt like you missed something, just rewind this and replay it because there's a lot that we, went through here, a lot of information. Kendra, I don't think I'm going to be able to get everything out of you in one podcast. So I think we're going to have to do another one of these. But
I would love to.
More importantly is like, where are you headed, man? I mean, like you got into this, and I just want to assume that there was some underlying reason why you chose the path that you chose, with helping people rebalance their hormones and live healthier lives because you were previously working at a hospital. I don't know if you're still doing that, as a, helping them out, but why did you, choose this path and what are you planning on doing in the future?
Exercise has always been very important to me. I love exercise. I did a short stint of competition, in my younger days, but I always enjoyed physical activity, fitness, exercise, weightlifting. And when you're in that field, when you're in the gym, this is what you hear about. You hear the back backdoor bro science, testosterone, steroids all the time. And I got to a point where I realized that there were so many things that could be changed by taking that kind of the idea that this had to be an illegal thing done in the back of a gym and bringing it to the forefront and saying, look, do it correctly. Do it where someone can manage your health. Do it to where this is not going to be a compromising situation for you. I mean, a lot of people, these are professionals that are doing this, at the gym. You're talking about people obtaining these concentrated vials that have a white sticker label on it that says testosterone. So it's like, you don't know where that came from. You don't know what you're putting in your body. And I was exposed to that for so long that I felt like there was a huge void in that community. And you can see it now that you turn on the news, you look at these articles about young guys that are dying, young bodybuilders that are dying, because again, they're pushing the boundaries, but they're not doing it in a safe manner. They don't have anybody managing their health, their blood work, keeping them safe. And that was one of my major drives.
Well, they're not practitioners. They don't have the
practitioners. They're looking on forums. They're doing and they're just talking to a guy that just heard it from somebody else. There's no theory behind it. There's no literature to back it up. They're just doing what we call bro science. And, that's what I wanted to do, was take the idea that this could be done legally, safely, and still get you to a point where you feel like a stud, whether it be in the gym or in your everyday life as a lifestyle guy, and without having the risk factors involved in complications, clots, blood pressure, aneurysm, heart attack, stroke, prostate cancer, all these things that you hear about that are problems in the community of bodybuilding. And that's what I started it as. And as I got into it, I realized that it was a much bigger problem, not even just in the bodybuilding industry, but it was on your guys that are 40 plus, that are just regular guys that go to work, and they don't understand the fact that this is a compromising problem. And I think that every person over 40, if you understand the fact that you can never be optimal unless you supplement a hormone that is depleting every year after you're 25, then why would you not be on something that's going to increase your quality of life and improve the overall health of you and try to keep you for the longevity? That's what I think we all try to do, is we're looking for the long term. We're looking for longevity and quality of life and living a healthier life longer. And I think that the new evidence-based treatment plans are opening the doors for a lot of that. But again, it takes recognizing that it's a problem and coming to a clinic that is savvy enough to understand that these things can improve with proper treatment protocols.
Yeah. And just one thing to note here too, because I know plenty of people who've either gotten on TRT or HRT, and they don't take they feel better, but they just naturally don't have that desire to go out and eat better and live a better life. So even though this is I would say the springboard as a magic bullet, right? You still have to go exercise. You still need to eat healthy. You can't just go to someone like Dr. Kendrick, get what you need, and then that's going to fix everything. You still have to do all the other things the right way too, but it's certainly going to make a huge impact on the way that you live.
100%. And again, that's the other thing. That's the other stigma, is I don't go to the gym. I don't need testosterone. That's the thing that I hear from people. It's like, look, this hormone, it didn't know you were going to the gym when you were 20. That's just part of you. It has nothing to do with the gym. I can tell you 10 other areas in your life that is going to improve before we talk about even the gym and the lean muscle mass and the ability to burn fat and increase your metabolic rate. So again, it's just this misconception. It's a great product. And I call it a product because it is synthetic, but it's a natural hormone. It's something that I tell people, I'm not doing anything magical. It's my approach is different, and understanding the fact that there is a normal and there's an optimal. And I just feel like everybody should be optimized and looked at as an individual versus corralled in this weird reference range that a lot of people end up getting overlooked and spending many, many, many years in a slump or being prescribed an antidepressant, because that's what happens from a primary care perspective. They look at your blood work and they say, look, everything's normal. You must be depressed. But normal doesn't always mean optimal. And that's the way that I think that there's a lot of people that get overlooked and prescribed antidepressants when I don't feel like their mental stability has anything to do with their symptoms.
So Kendrick, I really appreciate having you on. We're running out of time here, and I know that you need to get back to your practice. It looks like you're there right now. Where can the listeners find you? Where can you be found?
2 places. One, I do virtual consultations, so I can accommodate that. ForeverYoungMen'sHealth.com. I also have ForeverYoungWomen'sHealth.com that are specifically designed. I separated those just so, the information wasn't too garbled up there. But again, they can reach out there. I have forums on there that can, contact me now if you have questions or if you're interested in trying to, have a virtual consultation. Or of course, I have a brick and mortar that I see patients on an appointment only basis here in Biloxi, Mississippi. So, I'm pretty. I guess I got a good middle ground here. Where we're an hour from New Orleans, we're an hour from Gulf Shores area. So here on the Gulf Coast, I have a lot of people even drive over just because again they want to develop that rapport, and I like that. That face to face if you have the availability. But again. That's something that I don't want to be a deterrent because I can do this. I mean, essentially, I'm sitting in your living room right now. I mean, me and you are conversating just as if you were sitting in front of me, here. So it's still accommodating, but again, I like to have multiple options for anybody that wants to reach out. No deterrence. Give us a call.
Awesome. So you guys heard it first here with Dr. Kenrick McCarty. Love the show. Love all the information that you provided. If you missed some stuff, just rewind and replay. I mean, listen to it a few times. Okay, subscribe, follow us, share it with anyone that you think is going to get some value out of this. My kids always say sharing is caring, so be a giver. And Dr. Kendrick, pleasure, man, and looking forward to having you back next time.
Thank you very much, and I appreciate your program that I've implemented into my clinic as well, and it's definitely improved my efficiency, and I love it. So I appreciate that as well.
Thank you.
Thank you.